We now go to Laura Windsor with more information on Waterlase.
Thank you, Chris. Among the speakers here at the symposium were two associates of a pediatric dental practice, Dr. Rushita Jaju and Dr. Lynda Dean Duru, who talked about the benefits of using Waterlase on their young patients.
I think Waterlase has changed the face of dentistry for a big portion of the dentists who are advanced technology oriented. They have embraced this technology for how well it does for their practice, sets their practice apart from everybody else. It is really an everyday thing. I think today in our practice, we use laser for 99% of the procedures that we provide for kids. There are so many good parts to being a Waterlase dentist. I think for a child to not have to worry about being numb while I am working and after I'm working, not having the tingling feeling that is sometimes annoying because it feels like pins and needles in your mouth. But the perfectly awesome part is when you are done and the child says, "I'm done." That is the best part, and it always makes it so good for parents to see that, for our staff to see that, and for us to know that I truly made it comfortable for this child, for them to not know that the entire visit is over.
When I discovered the Waterlase, it was like night and day. I was just so happy to be able to do fillings and treat children without having to give them Novocaine, which we've gotten really good at as a pediatric dentist. However, after the procedure is finished, the child is always still frustrated because they are still numb. And so for me, it was a dream come true. It was to be able to give children what I wanted for them and not having them be in pain and have them even still be comfortable after the procedure. Over 95% of our children do not get Novocaine when they have fillings done. So that is huge for us. That means we've eliminated the fear of dentistry, and we have children who are happy to come. And the best part for them is when you finish and you tell them they can eat right away, they are so happy. And even the parents do not believe that, but it is true. And we've always made it our goal to make sure that we create a new generation of children who are not afraid to go to the dentist. So using the Waterlase sort of kind of ties into that. And the parents are just so glad because they're always so fearful. It's very common to see some of them just shedding tears of joy at how happy their kids were getting dental treatment in our chairs. So yes, knowing and using Waterlase does affect everyone. I'm happier for it. I go home much happier because I've delivered a full day of joy to a lot of patients and parents.
It is also still remains the future of dentistry because I teach at Children's Hospital in DC, and most residents do not get exposed to laser dentistry unless I am doing my laser lecture towards the end of their residency program. So when lasers become a part of the educational process, they will become the true present of dentistry. Right now, they are the present and future of dentistry still.
The advantages of this Waterlase technology is while it makes for a painless dental visit for the child, it brings considerable relief to the parent too. For the American Health Journal, I'm Laura Windsor.